Hey everybody, welcome to Pick Dr. Osborne's Brain. We're going to be taking your questions today, so do your best to get those in early so we can get to those. We're talking this week about how the system has failed us. This is kind of part 5, if you will. If you've missed the first 4 parts, go back, check those out. They're not something you want to miss. But we're going to try to keep our questions to that topic, which is, basically, in a nutshell, how many of you have struggled getting good advice from your doctors, from your hospitals, and other healthcare providers? Advice beyond the rhetoric of here, take this to mask your symptoms. Those are the types of questions that I want to help you with today. So without further ado, let's dive in. Let's see here. How long for your gluten enzyme to reach small intestines? It depends on your transit time. I don't know what other people's claims are or why they make the claims they make, but it doesn't matter what enzyme you take. The time for it to reach the intestines is largely going to be based on the transit time of the individual. So if you're a severely constipated person and you're having bowel movements every 3 or 4 days, your transit time is going to be slower. If you're a celiac and you have gastroparesis, your transit time is going to be slower. So it's going to take longer for that enzyme to make it if your transit time is slower. Now, there are pH wraps around capsules depending on the product itself. We take our product through what are called dissolution tests, which mimic the internal circumstance of the GI tract so that we can get a good idea of how it's going to get and where it's going to get and whether the enzymes are going to be released at the appropriate time. So, but again, I don't think anybody can make the claim that a product is guaranteed to reach your intestines at a certain time, because that is all based on the individual. Let's see here. 50-year-old female, menopause since 2020. 5'4", always in the range of 119 pounds, active and very fit. You guys are really going all out with the questions. I guess I should make the disclaimer, this show is not medical advice, so, any commentary I have is just for informational purposes, and please don't ignore the advice of a good doctor in lieu of the information that we're providing for you. Let's see here. Eat clean for the entire life, gluten-free, dairy-free, sugar-free after RA diagnosis in 2019 and lost 10 pounds after AIP diet regained over the years. Lately experiencing a change in the tissues, I don't know what that means, and gaining weight, 4 to 5 pounds, basically legs, lost tonicity and getting belly fat. TSH is out of range, T3, T4, reverse T3, T4, all in functional range, poor sleep, waking up. Well, that's a really, really long and complex question. Because what you're basically trying to get me to do is even with the information that you provided, which is long, it's nowhere near enough. If I were working with somebody in a one-on-one setting, it's nowhere near enough, even though it's a lot more than what a typical question might be. If you're struggling with weight gain and loss of tonicity in your legs, here's what you need. You need to work with a functional doctor who understands testing and understands what tests need to be done in order to help you figure out nutritionally what's missing, what's lacking, or what you're currently doing that is potentially hurting you or creating an inflammatory response. It's causing your body to store fat around your abdomen. And you're not going to guess at that. There's not going to be any great guesswork because you're already really doing a lot of solid things. If you're already grain-free, dairy-free, sugar-free, there could be some other foods that you're consuming as an example that you could be reacting to, causing, systemic underlying inflammation that's creating your problem. And without knowing what those things are, doesn't matter what else you do. As long as you're embarking on habits and lifestyle behaviors that create inflammation, it's going to be really hard to overcome that challenge. So you need data, you need information. Now, if your doctor won't run sensitivity testing on you, go to Gluten Free Society. We do that. Let's put a link up below on that side for testing, for food sensitivity testing. It's called delayed hypersensitivity response testing, because that's really where you should go next. Honestly, you're already doing so many things right. Let's see, Jessica says, you mentioned before that you don't like basements because they're a bad idea due to mold waiting to happen. What do you recommend on how to build a house without a basement, or what to look for exactly when buying a home that has no basement? Well, that's a big question too. I recommend, if you're in the market for a home, that you make friendly with a really good forensic mold investigator. So before you sign your name on the dotted line and invest hundreds of thousands of dollars into a home, that you get it properly looked at and get an eye on it for mold. A lot of people will hire a home inspector, just to do a general check of the house itself. In my opinion, those home inspections it's not that they're a waste of time, it's just that they're not going to give you any valuable information about mold. Home inspectors are not mold experts. So to me, if I were buying in the house to buy a market today, I would hire a mold inspector to look at that house before I invested the money into purchasing that house. Now, as far as if you're building a house, I recommend you hire an architect and an engineer who understand mold and can draft a blueprint of a home that you want to build with an eye for water control. In other words, there are a lot of factors. I mean, we could talk for hours and hours and hours and write textbooks about proper construction management and engineering of controlling for water in a house, because water is one of the main reasons why mold will grow in a home. So you really, until there's a major change in the industry, if you're in the market for a new house, you should really invest in the money to have a mold inspection done in the home before you move in. That's the best advice I can give you now, currently.
Someone was asking about the title. It's the book that's on the general table over there.
Oh, yeah, so somebody's asking about the book I was talking about the other day. It's here, Debbie. The name of the book is here, right? Can you see that? Is that showing up? Dissolving Illusions, Susan Humphreys. It's a great book on jab information, or inoculations, if you will. How do you suppose a celiac should use supplements after being on a strict gluten-free diet? How long before the body can do it on its own? That's a great question, Anne-Marie. So, I've done a show, several actually, but I talked about this a while back about the top 4 supplements, and I think we have a blog post on that maybe we can put up for you too. The top four supplements that any celiac should be taking, period. And these are just bare bones, what I have experienced in 21 years of practice in patients with gluten sensitivity or celiac disease, what is the most helpful if they have no testing information. So like they haven't run tests, they haven't done nutritional deficiency testing, but what's just the most helpful for these individuals to support their nutrition. And so we'll put a link up for you on that. Now, part 2 to your question is, can a celiac ever get to the point where they can just do it through food? The answer is yes and no. It depends. I've seen cases where the extent of the damage of years of gluten exposure has created permanent damage to the villi in the GI tract or in the intestine. Now, when that's the case, there's always going to be some degree of malabsorption, and so that individual needs to have their nutrition checked, in my opinion, twice a year, every 6 months, through a technology called lymphocyte response. And in this way, you can see how your nutrition pans out, and if you come back repetitively with vitamin and mineral deficiencies, number one, you know what to take, so you can get very specific and very customized with your nutrition protocol. Number two, you may find that your nutrition is very solid with the food that you're eating, and you don't need to supplement extraneously with a lot of different pills or a lot of different products. But I've seen it go both ways. I've seen people where the damage was so great that monitoring was the standard of care and the standard course of action that person needed, because they kept coming back struggling with deficiencies because of long-term damage. In essence, think of it like a scar. If you cut your skin deep enough, it scars, and where it scars, that skin tissue, that scar tissue won't grow hair, won't secrete oil, and it won't sweat because it's lost its function, it's lost its functionality. Well, if you get micro scarring in your intestine from years of gluten exposure, that area of your intestine won't work as well, won't absorb and won't digest nutrients from the food that you eat as well. And that's a potential possibility for many that are gluten sensitive. Again, it depends on how long you were, how much you were damaged, how long you were eating gluten, among a number of other variables related to your overall health. So I'm sorry I can't give you a yes, no, simple question, but hopefully that link I put up will give you a little bit more information about, what kind of things to supplement if you're celiac. Let's scroll down. Okay.
Yeah, it's blocked right now.
Husband diagnosed with diverticulitis. What can he do to heal it? So diverticulitis is inflammation, and it creates little outpouching pockets in the intestines. And then those outpouch pockets that are inflamed can trap food, and then trapped food can create infection and complications. So if you're struggling with diverticulitis, there's usually a reason. The number one reason that I see for people struggling with it is their diets. And so no grain, no pain would be a great place to start. If you have diverticulitis, just start that plan in your diet. Start that type of protocol first. As far as any kind of supplementation is concerned, I mean, not to say that these things will heal diverticulitis, but they'll definitely support healthy bowel function and support a proper inflammatory response. And one would be just a really solid probiotic, something like Ultrabiotic Defense in this case. Ultrabiotic Defense is our heavy hitter probiotic where there's several hundred colony-forming units of bacteria per serving. So that would be something to consider. And then something else maybe to consider for the inflammation in the GI tract would be like Ultra Turmeric, which is, it's our turmeric matrix that's designed on purpose not to absorb as well into the bloodstream. It's actually designed to stay in the GI tract where it has its anti-inflammatory effect. So that also may be something that's very effective and very helpful for him. Let's see, Laurie says, I asked my doctor to test if I had gluten sensitivity about 12 years ago. He said no, but if I felt better eating gluten-free, just continue eating gluten-free. I did that, but I did not understand what gluten-free really meant. He retired. I asked my new doctor, who also said no. My children got me a mail-in lab test for food allergies. It showed I was not allergic to wheat and gluten, so I started really eating it. Then my doctor said she would test me. 2 days later, she called and said I have celiac. Yeah, more of a comment there than anything else. But that's the problem with doctors today. They don't listen. Their egos are so massive. And I don't want to damn all doctors to this opinion, but this has just been my experience in 21 years of practice that, people that come to me, usually they come to me and I'm like the 9th or 10th doctor in a line of doctors, and the same story. It's my doctor didn't listen, my doctor wouldn't help me, they wouldn't run tests that were useful. And so how long did you go before you actually got your celiac diagnosis? How many years of gluten exposure did you subject yourself to before you knew it was actually the right move for you to make? And that's the problem. Doctors should be more open to testing, because even if we just look at how many people are gluten sensitive, like if we look at major medical journals and research in the field of gastroenterology, it's estimated that 7 to 13% of the population has gluten sensitivity. So odds are, if you're asking your doctor to test you, there's a 7 to 13% chance that test is going to come back positive, and we're just looking at general statistics across the US. So it's like 1 in 10 patients, right? So the doctor shouldn't be just so standoffish that they're not willing to run that type of test for a person who suspects it. They should be a lot more open to helping you out. Anyway, my advice to anyone who is frustrated with their doctor is to fire them and find a new doctor. Any suggestions for Sjogren's and thyroid disease? Lots of suggestions, actually, but the number one suggestion is, Laurie, is no grain, no pain. Follow the diet. Beyond that, testing and not guessing. So many people try to guess their way through autoimmune disease, and understand that with autoimmunity, and that's what Sjogren's is, that's what thyroid, if you're talking about Hashimoto's, which is a form of autoimmune thyroid disease. There's 4 categorical triggers for autoimmune disease, 4. And they're categories, not 4 triggers, but 4 categories of triggers. So one category is food. How many different foods are there, right? There's hundreds of foods that we are exposed to on a regular basis. Gluten is just one element in food. You could be reactive to other things or other foods that if you don't test, you don't know, right? And so that's one category. And then we have the category of chemical exposure. And, there's lots of different chemicals that you can be exposed to. Some of those very chemicals are in your food. Some of those chemicals are in your soaps and shampoos and cosmetics and toothpaste or mouthwash. And so, knowing, testing allows you to know, and knowing allows you to change. And then the third category is nutritional deficiency, where there's 40 essential nutrients. Those are nutrients your body needs and cannot function without. And so not knowing whether or not you have deficiency, there's 40 different things there that it could be. And then, beyond that, it's microbes. Microbial imbalance is the fourth category of triggers. And if you don't know whether you have that, most people don't. Most people just try to guess their way through probiotics. Look, the reality is those four categories come with an infinite combination of possibilities of why your autoimmune diseases might be triggered. So if you're just trying to say, what can I do for Sjogren's in general? My best generalized tip would be follow No Grain, No Pain, because that book is based on 21 years of clinical research and 21 years of practice. And so the information in that book can be very valid and very helpful for many. But at the end of the day, if you're already doing the book, if you're already following the No Grain, No Pain diet, and you're still trying to figure it out, you need testing, period. And I can't give you better advice than that. Can probiotics help with anxiety? Yes, they can. There are certain strains of probiotic that can help. Sometimes people have yeast overgrowth, and yeast can actually trigger anxiety, and so certain probiotics are helpful against yeast. One in particular, we have something called Biotic Defense with S. boulardii, which is helpful for balancing yeast. And so, you might consider that as something to start with. But yes, probiotics can help with anxiety, but it's not necessarily that probiotics will cure everyone's anxiety. Lori came back and answered 12 years. So 12 years she asked her doctor, 2 different doctors, to test her for gluten, and they all said no, until finally somebody tested her and she was positive for celiac disease. So 12 years of gluten-induced damage. It's a medical travesty. It's malpractice, the way I see it. Those doctors should have tested you, and the fact that they ignored you for that long just goes back to what I said earlier. If you have doctors not willing to work with you, listen to you, and empathize with your situation, and they want to gaslight you, it's time to fire them, and it's time to go hire a doctor who will listen. Hire a doctor who cares, who has good bedside manner, and will give you more than 5 minutes. Right. I mean, the reality is, if the system, one of the big reasons the system has failed us is because doctors don't take the time to listen, and there are a lot of reasons for that. I don't want to put all the blame on doctors, because the blame is not just on the doctors. The blame is also on the patients. The blame is also on politicians. The blame is on a lot of things. It's a multifactorial issue. But so I don't want to doom or damn all doctors. But at the end of the day, it's up to you. It's not up to the doctor. It's your health. It's your body. It's your life. You have to be able to have a relationship with a doctor who cares about you, who you can trust to give you good, solid advice or to help you when you need help. And if your doctors aren't doing it, find one who will. And that may take, going to 3 or 4 or 5 or 6 or 10 different docs to find one that actually gives a damn. But it's up to you to make sure that you're doing that. Okay, let's see here. Have you heard of autoimmune? Let's see. Have you heard of autoimmune issues RA due to titanium dental implants? I'm about to go through heavy metal testing to determine if that may be the cause. Well, not so much. I've never seen a case, James, of titanium being the trigger. That's not to say it couldn't be. I mean, I've seen other heavy metals be triggers in autoimmunity. But generally speaking, not titanium. I've never seen a case where titanium was the cause. So that doesn't mean it can't happen. So I think it's a good idea that you're getting tested. In my experience, the vast majority of cases of RA that I have seen are typically, they're definitely gluten. In 20 plus years of practice, I've never seen a case of rheumatoid arthritis where the person didn't have gluten sensitivity after being tested. Number 2 would be Microbial imbalance. There are several types of bacteria that produce toxins that can trigger RA. Klebsiella, Pseudomonas, Citrobacter are three probably the more common ones I've seen in people over the years be triggers for RA. So there's something else you might want to talk to your doctor about, is just having them do some type of stool culture or blood lab work to rule out different types of bacterial processes that could be a trigger for you. And then beyond that, it's food and vitamin D. Vitamin D deficiency can in and of itself be a major trigger for autoimmune RA. Okay, Missy says, my 23-year-old daughter went in for a routine CBC blood test. Her platelets, red blood cell count, and white blood cell count were elevated. Her doctor referred her to a hematologist at the appointment. He told her she has an essential thrombocytopenia. I came home and researched it and found it can be caused due to gluten intolerance. She has had the DNA test through Gluten Free Society's website, and she has 3 of the markers. She had not been following the diet, but after I told her this, she has followed a true gluten-free diet, as well as taking 4 cayenne capsules a day and 2 garlic capsules a day, plus drinking purple grape juice to help lower her platelets. My question is, how long to wait to get another CBC to see if her numbers are decreasing? Generally, with platelets, if gluten's playing the role, 6 months would be a good time to wait. It takes 2 to 3 months just to stop the onslaught of gluten-induced inflammatory damage. So you've got to give it at least that, but I would say 6 months if you're trying to see changes on blood work. Her doctor may want to test it sooner, which I wouldn't be opposed to, but I would say at least 6 months. And if the counts are still high, that's when you want to recommend that your daughter get additional testing around other potential triggers, because gluten can be a trigger, but there certainly are other nutritional triggers as well. Other foods can be triggers, and nutritional deficits can also be triggers. Yeah, if the hematologist wants to put her on baby aspirin for the rest of her life, I'm not going to tell you what to do, but I will just tell you this. Baby aspirin is about 85 milligram dose of aspirin, depending on the company. 75 to 85 milligrams is the dose in one baby aspirin. Now, it takes 1/10 of that. It takes about 7.5 milligrams of aspirin to cause gastric bleeding. Now, think about that in terms of being on that drug for the rest of your life. 7.5, so 1/10 of the dose of a baby aspirin can start gastric bleeding. Now, once you start gastric bleeding, that can increase the risk for ulcers and subsequently can increase the risk for the development of cancers in your stomach and small intestine. Now, let's fast forward that bleeding can also cause anemia through iron loss, because when you lose blood from intestinal bleeding, by the time that blood comes out in your poop or comes out in the toilet, it's brown, it's oxidized, so you can't see that it's there. It's not like a hemorrhoid where, when some people have bright red blood in the toilet because they have a hemorrhoid. Oxidized blood from aspirin stomach damage causes what we call occult blood loss, meaning you're losing blood, but you don't know that you're losing blood unless you get the appropriate testing. And so what happens, a lot of people develop anemia, low oxygen. Now, low oxygen can increase your risk of infection. Low iron can also increase the risk of a number of different types of diseases because it causes oxygen deprivation to your tissues. So that's, neuropathy, muscle pain, brain fog, dementia, right? We're just talking about 1/10 of a baby aspirin, not a baby aspirin, 1/10 of the dose of a baby aspirin. So the other things you have to consider about baby aspirin is that they cause folate deficiency, long-term use, and vitamin C deficiency. So now you can suffer the consequences of long-term latent nutritional deficiency as a result of following advice like that. Ultimately you have to make your own decision, get with a good doctor, and feel comfortable about that decision. But if it were my child, there's no way in hell I would put my child on a baby aspirin for the rest of their life off of the advice of a doctor who can't even tell you why the disease exists. So that's just my 2 cents. I like this. Marianne says, political dictatorship, not testing, not listening to or believing the patient, but advocating for grains and at least oats. Thanks to your channel now, 11 years gluten-free, but 50 years of gluten damage took its toll. Still, medical gaslighting continues in my country. It's taboo to believe in gluten damage without outright celiac having caused anemia. Ashamed to name my country. Keep up saving millions of lives. So I'm sorry you've had to go through that, but keep rocking on. You have to be your own advocate. And let that, for any of those of you who are watching, again, you've heard me say this before, it's not the job of the doctor to make sure your health is in order. It's the job of the doctor to help you try to find why your health might not be in order, but ultimately it's your responsibility. And I think, we could probably say this of most industrialized countries today. We've lost something, and to me, we've lost a lot of things, actually. One of the biggest things we've lost is personal responsibility. Your body is a gift. I mean, it's a gift from God. You only get one, and you're here, and you want to make the most of it, and you want to do the best with it. And so if you don't care enough about your own self to question or challenge the rhetoric, then no one else will care more. Your doctor, I can promise you your doctor doesn't care more. I can promise you that. If I can promise you anything, it's that your doctor doesn't care more about you than you do. And so a lot of people get that initial advice, follow it, without questioning it ever, right? We saw this in the last 3 years. Look at how many doctors failed us in this last 3 years. I mean, really, if life were fair, we'd probably have an old-fashioned lynching going on right now with vast swaths of the medical community because of the crimes against humanity they committed by allowing this atrocity to happen. And I'm not even just talking about shots. I'm talking about lockdowns and muffling of our children and social isolationism of entire cities and populations. Like, none of these things were scientifically valid or ever proven, yet our medical community didn't stand up and advocate for our rights. They just laid over like cowards and said, yes, that's what we should all be doing, even though, again, there was no evidence that it would be effective for work. And we saw it play out. Now everybody's looking backward, realizing that. Not everyone, but many of you are, and fortunately so. And maybe this had to happen to wake everybody the heck up. Let's see here. Jan, gluten-free since 2010. Let's see, I'm not sure. Miss V following the second vaccine, emergency surgery within 72 hours of the vaccine, lost 50 centimeters of jejunum. Gut issues continue after 2 years. How to eat? ? Already cut red meat, milk, sweets. Family history of autoimmune disorders. Other organ systems also impacted by the inflammation. I think if you were injured in that way and you lost that much of your intestine, of your jejunum, 50 centimeters, that sounds like an awful lot. I would say, Jan, it's time to not guess, honestly. I mean, you could follow no grain, no pain, and it may be a good place for you to start in terms of your diet, but you really got to work with a functional doc and get some things figured out. I mean, that, to me, that's too aggressive of a problem to try to generalize your way through it. That would just be my advice of finding somebody you can work with. Let's go down a little bit there. So a question about blood shedding in the urine. For 30 years, I've had trace blood in my urine, no infection. I've had many tests over the years showing no cause. Yesterday, my urologist told me that 30% of the population has trace amounts of blood in their urine. Is it the way your body sheds cells? No, I wouldn't agree with that statement at all. Look, I do a lot of testing, and I don't see 30% of even my highly sick autoimmune base showing up with that level of blood in their urine. I would disagree. I mean, maybe your urologist sees it at that level, because by the time people make it to a urologist, they've got problems, urological problems that they're trying to get diagnosed. But I would say I don't see it in 30% of my own patient population, and I wouldn't agree with that. I'd say there's a cause. It's not just natural to have blood showing up consistently. You probably got some type of inflammatory damage either to your kidneys or to your ureters, or maybe even a little bit further up north, that should be investigated. That would be my opinion. So maybe go to another urologist to get a second opinion. Yeah, so would you let your child go 3 months before retesting a CBC to see if platelet numbers have come down? I mean, if they're that high, I would check them. You know, following a gluten grain-free diet, I would check them at an interval of 3 months. I might even check them at an interval of 2, just to see if the diet's making any kind of an impact sooner, as opposed to, you know, to waiting. There's no harm in doing that. How high is too high for what? How high is too high for what? I don't know what, Missy, I don't know what you mean by how high is too high. Skin on my ankles is brown for several years. I had a fall which must have damaged the nerve. Was diagnosed 2.5 years ago with Sjogren's, and I have peripheral neuropathy and finger joint pain. I think you mean Army doctor has me using a nerve balm with frankincense. What could have caused the bronzeness or the brownness in the lower leg is if you've got a neuropathy in your lower extremity, you know, the question would be, is it a glucose-induced neuropathy or a diabetic type of neuropathy? Because it's very common to see diabetics have kind of a browning or bronzing of the lower extremity, especially, you know, from the ankles down. They'll actually even start to lose the hair on their legs if they're men, and so that skin will become a little bit swollen. It'll become brownish in color, and that can be caused by glycation, which is a byproduct of sugar moieties interacting with the proteins. And so, you know, there's a term used in medicine called acanthosis nigricans, which basically means darkening of the skin. And a lot of times with diabetics, where you'll first see that is on the back of the neck, in the fold of the skin, right in the crease of the back of the neck. But that can happen in the legs too. So, you know, you might have your doctor check you for diabetes, because if you're diabetic, that makes sense. And then instead of using nerve balms, you get to the root of the issue, which is address the diabetes through diet and lifestyle change. So how high is too high for platelets? Is I think the follow-up to that question. Go up just a little bit. I want to make sure I've got that right. So the question is, how high is too high for platelets? I mean, you know, the reference range, anything over 450,000 is too high. I think how high is too high is a relative question, depending on the patient, depending on the age, depending on their size. But I would say it's concerning if they're up over 1 million for sure. You want to get to the root of that. So I would say, again, going back to the question earlier, which is, you know, should I check my child at 3 months? Yeah, I mean, again, if you're trying to use diet as a tool to see if the platelets will come down, then definitely it's something you can check sooner rather than later. I don't know if that answers your question, but yes. Let's see. Can you talk about testosterone and gluten sensitivity? If you're gluten sensitive and testosterone and estradiol are low, FSH is borderline high, should you get testosterone replacement? Not necessarily. I mean, it depends. If you're gluten sensitive and you're not following a gluten-free diet, you know, I don't think testosterone replacement, I think that might be premature. I think you've got to let the diet work its magic, so to speak, before you can make a determination as to whether or not you'd be a candidate for taking testosterone. So remember, with any hormone, I mean, a lot of doctors are quick to dispense them, and sometimes they're indicated. Sometimes it's the right move. I'm not going to say that taking hormones is necessarily bad, but a lot of times what I see is doctors will put people on hormones after testing their hormones, but they'll never ask the question, why is the person's hormones low? Right, and so as an example, the classic example in the U.S. And probably the U.K. and Australia and again Europe, with the widespread use of statin medications for the aggressive approach to cholesterol that doctors take for risk of heart disease, Cholesterol is a building block that allows your body to produce estrogen and testosterone. And so we have so many people being put on statin medications to lower cholesterol, and then they end up later down the road with low estrogen and low testosterone because they're suppressing their body's ability to create the backbone of those hormones by suppressing cholesterol formation. Remember that you need bad cholesterol. LDL is the precursor to your sex steroids. So your estrogen, your progesterone, your testosterone, your DHEA, pregnenolone, all those things come from cholesterol. So suppressing it is a very common reason why people have low levels of hormones. Certainly that's just an example. There are many other reasons. Gluten sensitivity can be one of those reasons as well. But I think ultimately, Gary, if you're trying to figure out whether or not your doctor should prescribe you testosterone replacement, first talk to your doctor about why the testosterone might be low, and don't take age as an example. Don't take age as the reason for the answer. Like, age is a cop-out answer. Anytime a doctor tells you it's because you're getting older, it's because they don't know. That's mostly true. Probably not 100% of the time, but the vast majority of the time, if a doctor's telling you we don't know, but you should just accept it because you're getting older, that's BS answer, and they don't have an answer for you, and you should get a second opinion. Let's see, can taking too much potassium lower sodium? I'm taking potassium for anxiety. It really works well. Taking potassium is not going to lower your sodium. Now, if you're taking potassium and it's working well for you for your anxiety, don't forget that sodium is an important nutrient too, and a lot of people have quit salting their food. So, you should be getting sodium in your diet in a healthy manner, just like you should be getting potassium in your diet in a healthy manner. But I wouldn't worry about potassium supplementation causing sodium deficiency per se. Now, if you're really concerned about it, get with your doctor and check your levels, for the first few months of, supplementing with higher doses of potassium to see how it is impacting your other electrolytes, and that would be a way that you would know for sure. But as a general of thumb, no, potassium supplementation is not going to lower your sodium. Let's see, Linda says, my platelets are low and homocysteine is 6. You said perhaps more B12. I don't know when I said that, but am I getting too much B? I don't know if you're getting too much B, Linda. I would say that you need to get it tested. Generally speaking, people don't get too much B. B vitamins come out in the urine, and there's really only one B vitamin that has any historical documentation medically of creating problems for people, and that's vitamin B6. High doses of B6 over prolonged periods of time can create neurological symptoms in many folks, but as a general of thumb, B vitamins are urinated out relatively quickly, and so it's, there's no great reports of anybody ever overdosing on B vitamins again, outside of vitamin B6 potentially causing some neurological symptoms. Let's see, Valerie says, do you have a recommendation for sleep? As a general of thumb, there's a lot of recommendations for sleep. I'd say start with going to bed on time. Start with going to bed. Ideally, 10 p.m. to 2 a.m. is when you want to be asleep, right? So plan your sleep around that. So if it takes you an hour to fall asleep, then, be in bed by 9 so that you can be asleep by 10. But, outside of just going to bed on time, sunshine is very critical for sleep. Exercise is very critical for sleep. Stress management is very critical for sleep. If you're talking about just general supplementation, that could be supportive of sleep, lots of different things. We have a controlled sustained release melatonin that you could try to see if that was helpful. We have something called Ultra Sleep, which has a number of different herbals and vitamins in it that can help support, regulate sleep as well. But we've done entire shows, Valerie, on sleep, and maybe we can put a link up to one of our sleep videos for you, and you can do a deeper dive than what we have time to do today. Why is my doc still insisting that I have upper and lower GI? I mean, your doctor's recommending that you have an upper and lower GI test done? I'm not sure about your question. Putting probable celiac disease on my chart, I have HLA-DQ. So what they're trying to do, it sounds like, if you have positive HLA-DQ genotype for gluten sensitivity, what they're trying to do is confirm whether or not you have celiac damage. And so a lower GI won't confirm that so much as an upper GI will. Remember, celiac damage typically occurs in the upper intestine, not in the colon. That's not to say that gluten damage can't happen in the colon, but generally speaking, if they're looking to try to diagnose celiac disease as opposed to a diagnosis of probable celiac disease, it's because they're trying to isolate and identify whether you have villus atrophy. Because the hallmark in medicine, there's a criteria in medicine to diagnose celiac disease. You know, one of the main criteria for the diagnosis is that you have positive villus atrophy findings on an upper GI in your small intestine. And so that's what they're just trying to confirm that. You know, I would argue that if you are on a gluten-free diet and you're feeling better and you're recovering, that there's no need to put yourself through that just for the sake of confirmation. I mean, sometimes confirmation is when I eat gluten, I hurt and bleed. When I don't eat gluten, I don't hurt and I don't bleed. That to me is enough confirmation to know that, you know, you're reacting probably to gluten. But so many people really want a black and white answer as to whether they have celiac disease, and that's why your doctor's insisting that you have that test, because he's trying to get you a black and white answer. Now, the problem with doing a scope is that you can get a false negative on a scope. And so just because you have, you know, the worst I'd ever seen was a woman who had 19 biopsies. So had 19 upper endoscopies with 19 different biopsies performed over the course of her lifetime. And she was an elderly woman. And they were all negative, meaning that they all came back negative, and the 20th one came back positive. So it took 20 tries to get a confirmation of villus atrophy and a diagnosis of celiac disease. So just understand, not everybody takes 19 or 20 times. Some people get it on the first time, and sometimes people do it once or twice and don't get it, but they're still gluten sensitive and their diagnosis is being missed. And this is why, in my opinion, that using the upper GI as the gold standard for the diagnosis of celiac disease is a mistake. Because a lot of people get stuck in no man's land. Because remember, a biopsy is a microscopic take on your small intestine. Your small intestine has a surface area of the size of a tennis court, which is pretty vast, right? So you think about what a biopsy is doing. It's like taking a little microscopic piece of that tennis court and saying that that little tiny piece represents the whole tennis court. It doesn't. Biopsies can be diagnostic, but they can also be misleading, and you can get a false negative, and that is not helpful if that happens to you and you truly are gluten sensitive. Let's see here. Do you need a gut microbiome test before starting probiotics to know which probiotics are needed? Not necessarily. I mean, it can be helpful information though, Brenda. Can eating sauerkraut cause histamine flares? It can if you're histamine intolerant. There's certain kinds of bacteria in sauerkraut that can create a histamine flare. There's certain kinds of bacteria in certain probiotics that can create a histamine flare as well. A microbiome test is not going to tell you, though, whether or not you're going to have a histamine flare to certain probiotics. So there's a limitation to that. It can't really tell you that. If you have a histamine intolerance or you're having histamine flares, I would encourage you strongly to get your nutritional status checked. A lot of people with histamine intolerance are vitamin C deficient. Vitamin C stabilizes the histamine release from your mast cells, and so vitamin C deficiency oftentimes will cause excessive histamine release. Gluten can also cause histamine intolerance because it damages the GI tract's ability to release the enzyme that breaks histamine down. That enzyme's called DAO, and you can actually ask your doctor to measure your DAO. That stands for diamine oxidase. And if that enzyme, and also ask them to measure tryptase, those two enzymes help you break histamine down. And so if you're not making them properly, then you have to start thinking, okay, what's damaging my gut's ability to produce these enzymes? And that, one of the hallmarks of that is gluten. Gluten's a big one. Other foods can do it. Mold can do it. So there's a lot to unpack there. I have several white foci on my brain. Should I be concerned? Maybe. I mean, you talk to your doctor about, what they think. I mean, it's a matter of not just the foci, but also symptoms. What's going on symptomatically? What's the clinical picture for you, Brenda? And we can't get into that, but I think there would be concern if that were my MRI and I was being told that. I would be concerned to a level where I'd want to investigate why. Can a typhoid infection lead to a leaky gut? Yes. What would you suggest for kids with parasites or how to clear them? I'd suggest you follow up with a doc and figure out what's going to work best for them. We use, in my household, we use a supplemental called intestinal defense. Because I'm on a farm, so we do kind of periodic deworming, if you will. A lot of people, 50 years and older remember this, that they grew up in more rural areas where, once a month or so, their parents would, in a sense, deworm them because they're, working with animals and there's animal poop and there's the higher risk of, being exposed to different types of parasites in that way. But intestinal defense is a supplement that we use, once a month or so to do just kind of a general intestinal cleanse with. And it's got things in it like, artemisinin, which is a plant-based antiparasitic. Artemisinin, interesting story. Artemisinin shared the Nobel Prize with ivermectin. They shared the Nobel Prize when they were both discovered. They shared that prize in the same year. And most of you know what ivermectin is because the last 3 years it's been, dramatically prescribed by many doctors trying to treat COVID. Does your food sensitivity test work for a 3-year-old? Yes, it does. The earliest that our food sensitivity test that we recommend, we don't recommend anyone younger than 2 take it, and for more reason than one. But as a general rule of thumb, children under 2, I'm just not a fan of drawing their blood unless there's a really major need to do so, like a life-threatening need to do so. Let's see here, Tina. Heart failure is heart oxygen insufficiency. How can I get off all meds? I don't know the answer to that, Tina. I can't give you the answer to that. Too complex of a question for a show like this. I'd say if you're wanting to make an attempt to get off of medication, you've got to work with somebody, preferably who has an eye for helping you get off of them, but also helping protect your heart and protect you from, doing yourself further damage in the process of making that transition. And so my advice there would be find a good functional doc you can work with. What might cause my hands to be going numb during the night? My trainer said it's something going on with my central nervous system. Every night it makes me wake up, I change position and move my hand and it gradually goes away. Well, it's not something in your central nervous system, most likely, Laurie. It's a lot of times when people sleep, so there's a pressure point here, kind of right in this area, and if you fold or bend your arm, you have a nerve that runs through there, and if you've been working out a lot more and your muscles are growing, sometimes you bend your arm like under your pillow when you're sleeping, or you fold your arms up next to your side. You can put pressure in that tunnel and you can compress that nerve, and then your hands will go numb, and then you'll wake up because your hands are going numb. That would be the first thing that I would suggest that you pay attention to when you sleep. Now, sometimes too, what happens is people sleep with their arm out, like this, and if their arm is rested and there's a pillow or something right here under that tunnel, that nerve tunnel, then that might also put pressure in that area, and so their hand can go numb. So first, before you think it's a central nervous system problem, pay attention to the positioning of how you're sleeping, because if you wake up and you move your arms around and it goes away, that's probably positionally related more than it is some type of esoteric neurological degradation disease. I'm sensitive to gluten. Is it also necessary to avoid all gluten-derived ingredients? Yes. If you're sensitive to gluten, it's necessary to avoid all gluten-derived ingredients. I would say, yeah, it's definitely where you'd want to start with your diet. A girlfriend of mine had a booster 6 months ago. She never felt well afterwards and had trouble walking. She had a massive heart attack and died at 62. Have you heard of other stories like this? Yeah. We've seen, Jane, numerous people. I mean, in the last year and a half, I only take on about 350 cases a year in my practice. And in the last year and a half, I've probably seen close to 100 injuries post-shot. Some of them horrific. I've had a gentleman who went from being fit and exercise-oriented to, being wheelchaired. I've had people develop severe neurological consequences. I've had some people die. I've had some people, have strokes. So yeah, I mean, we're seeing it. I've had some people who, whose cancers were in remission, their cancers returned. It's a tragedy. It's a travesty. All this that's going on out there. I really, I know there may not be a reckoning in this world, but I really hope that that God is looking out and looking at how this happened and who allowed this to happen, and I hope He's got a special place for those folks, because it's sickening. It's heartbreaking for so many of us. Okay, my husband recently had a reading on a non-DRE urine-based liquid biopsy test called ExoDx. Have you heard of this type of test? No, I can't say that I have, Mary. I wish I could be of more value to you today, but that's just not something I'm familiar with. What can be a possible cause of Paget's disease of the bone? I follow your suggested diet exactly and have seen many health issues disappear, such as migraines and elevated LFTs and spastic colon hyperthyroid. So Paget's, I would say the diet, should also benefit you in that direction as well, but it might also serve you to get, again, I'm going to sound like a broken record, Cheryl, but get other foods tested for, get nutritional deficiencies tested for, get chemical reactions or responses tested for. Those are all things that I would start with, so that you can get more specific on how you can empower yourself to make diet and lifestyle changes to help your body heal. I get awful inflammation in the gut and in the brain after doing intense workouts. Is it related to leaky gut? Maybe, but I've seen cases too, Ahmed, where people work out where the gym was super moldy. And so going into the gym, they're exposed to massive quantities of environmental black molds, and it makes them sick. Actually, I just had a case where we discovered that a few weeks ago. Interesting that you're bringing that up too, because that would be something that I would suggest is maybe if you work out at a gym, do you smell a musty, moldy smell? If you do, maybe consider switching gyms or working out outside instead, and see if the same thing happens when you're working out in a different location. If it doesn't, maybe it's mold. If it still happens, it could also be sometimes if the workout is intense enough, you might just back off on the intensity. Sometimes, when the intensity is too great. Remember, high intensity workouts can cause transient leaky gut and can lead to certain issues as well. So it may just be the exercise is too intense for you. What can be the cause of a throbbing ankle leading to cramps in the second toe? If it's just on one foot, it could be ankle weakness. It could be mineral deficiency. Calcium, magnesium deficiency can cause cramping of the toe. It could be that you need your foot and ankle adjusted. Sometimes people get what are called subluxations in the way the bone structures line up in the ankle and foot. And so a good adjustment, chiropractic adjustment of the ankle might be what's in store. It could be beneficial. Try those things and let me know. All endocrine labs normal range, T4 doubled all of a sudden, and antithyroid peroxidase has been higher for years. Any suggestions? What's the T4 getting higher mean? Well, I mean, if you're on medicine, Kelly, your T4 dose might be too high. You talk to your doctor about that. If it doubled all of a sudden, did you have a medication change? Or if you're not on medication, then you definitely want to look at diet change if you're not already. I mean, one of the biggest triggers for thyroid dysfunction is gluten. I mean, there've been, I think, to date, somewhere around the neighborhood of 300 plus research studies that confirm that, gluten-free diets are very helpful for the thyroid. So if you're struggling there, you really should, consider diet change. So Linda says, my TSH is below standard level. I think that you said if it's under the standard level, it means that a person may be over-medicated. Difficult to find a doctor that truly understands the thyroid. Yeah, I mean, that's exactly right. That if your TSH is too low, if you're on medicine, you might be getting too much medicine. In that case, you should talk to your prescribing doctor about it so that you get that dose reduced. And here's why you would want to do that. Too much thyroid hormone, medicinally speaking, too much of the hormone can cause heart palpitations. It puts pressure on your heart. It can cause hot sweats and night flashes. It can cause anxiety. It can cause agitation. It can cause dry skin. It can cause hair loss. It can cause adrenal fatigue. Too much thyroid overworks your adrenal glands, and so it puts your body into a state of sympathetic dominance. And all those things are not good, right? Obviously, we want to try to avoid those things. So if your medicine's too high, it's a real easy thing to ask your doctor to adjust the dose and then monitor it after that. And a lot of doctors, when they do dose adjustments for their patients, a lot of doctors aren't in the habit of helping their patients get off of their medication. They're kind of more in the habit of adding medication or raising the dose. But a lot of doctors, they're not well practiced at lowering doses. And that's just because it's not typical for people to take less medicine as they age. It's typical for them to take more. But that being said, when you're working with your doctor, if you're trying to talk about a dose reduction, one of the things I've seen doctors do to patients where patients struggle is when they try to reduce thyroid medicine too fast, too much of it. So like, let's say for example, you're on 60 and then they want to cut it to 30. Like that, in my opinion, might be too high or too quick of a dose reduction. And so, anywhere from 10 to 15% reduction would be what I would talk to your doctor about and encourage looking at a kind of a stable, slow taper down with tight monitoring of your TSH, T3, T4 to make sure you hit the right dose accordingly and that you don't overshoot it. Because what happens a lot of times if the doctor reduces the dose too much, now your TSH is shooting way up and now they want to take you right back up to that dose that was originally too high, and then you end up yo-yoing back and forth. So you really got to work with the doc and talk to them about incremental small adjustments with tighter monitoring of the levels so that you can get to that right level for yourself. Love this. So Maria says, red, no grain, no pain, changed my diet, has greatly improved my bladder incontinence. Thanks for sharing your feedback, Maria. Why have we heard nothing about the jabs from Suzanne Humphreys the last couple of years? I don't know, Mark. I don't know. I can't speak for what other doctors are saying or not saying. I know there are a lot of brave doctors out there risking their careers and their livelihoods to speak up. And I know there are a lot that aren't, but I can't speak for what she's doing or not. But that book, nonetheless, is a fantastic read, and it's a fantastic resource for anybody trying to understand the topic better. Vaseline on dry lips, is there anything negative with that? Yeah, Vaseline is a petrochemical. You don't want to rub petrol all over your face. I would say use like a beeswax-based chapstick over using a petro-based one. I mean, there are plenty of brands out there that you can tap into. I wonder, so Bridgie says, I wonder if diet change would help with perianal dermatitis. A friend has it over 40 years and she is contemplating on changing some lifestyle elements. Is there anything you can suggest? Yeah, no grain, no pain. No doubt about it, diet change can affect dermatitis around the anus. And so you remember the anus is generally, it's inflamed as a result of, what's coming out. And so what coming out is what was going in. So diet change is definitely the first thing I would look for. On day 10 of 14 days water fast, trying to heal my gut, feeling great after a month of processed carb grain, visiting family. I've done prolonged fasting before taking electrolytes, salt, B complex. I don't know what your question is there. So you're on day 14 or day 10 of a 14-day water fast and feeling good. I'm okay with that. I'd say my thoughts on that would be, when you add food back in, do it slowly, do it cautiously, start with liquids, and pay very close attention, because if you feel good on a fast like that, generally speaking, it's because if you felt bad not on the fast, it's because whatever it is that was in your diet could have potentially been harming you, so pay attention to that. What can I do to decrease LPS? Define LPS. Do you mean lipopolysaccharide? What are you referring to? Because there's a lot of acronyms out there, and I want to make sure I have the right one. How can we get titanium dioxide out of our bodies? I'd say, one, don't use products that contain it, because that's how it gets into your body. So step one in getting it out is to not put more in. And then sauna, infrared sauna would be a good tool to tap into. Exercise where you sweat. A lot of people exercise in an air-conditioned gym and they never really break a sweat, but sweating is an important way that the body rids itself of toxins. Maintaining good bowel function and bowel movements, because some of this stuff's going to come out through your poop. And if you want supplemental support, use Ultra Metal Detox. It's a blend of different types of natural chelators that can help support the body's ability to rid itself of metals, unwanted metals. So there's a question in here, KEH6601, about DNA test results. Reach out to glutenology@gmail.com, and they can answer that question better than I can. They handle that aspect of things. But just reach out to, it should be Malaya. If you just reach out to her, she can take care of you. Have you ever heard of anyone's urine and bowel movement smelling like burning firewood? Yeah, and that's not normal, and so there's something that you're doing, something in your diet. You might have a bug. I'd get with a good doc who can do some diagnostic testing on you to help you determine what that is. What long-term side effects are to be expected from 2 puffs of Foster asthma inhaler plus steroid around 5 times per week? I think with steroids, the biggest long-term risk of steroids is, they raise your blood sugar over time, they raise your blood pressure over time, they can cause muscle loss over time. Nutritionally, they can cause vitamin D, calcium, magnesium, zinc, selenium deficiencies. Because they raise your blood sugar, they can tax your chromium storage and status. So those are all kind of longer-term side effects. I would say you want to know those things, but at the end of the day, why do you need an asthma inhaler? Like, asthma is an autoimmune disease. If you're dealing with the core of why you have it, then you don't necessarily need, to take an anti-inflammatory on the regular. So, asthma, in my experience, gluten is a major, major contributor to many folks' asthma. And it's not to say that all forms of asthma are caused by gluten alone, but I would start with that. I would start with diet change. Dairy is a major contributor to asthma for many people. Sugar, definitely. Gluten, definitely. So start with no grain, no pain if you haven't already, and then you don't have to worry about the long-term side effects. So many people, you get involved in medicines, and then you worry about the side effects of the medicines, but if you just figure out, fundamentally speaking, medicines do not solve disease. Medicines mask symptoms. So if you're at home and every time you turn your pipe on, water bursts out all over the floor. Every time you turn your sink on, you don't get fresh new towels every time you want to use your water and mop up the floor. What would you generally do? You would fix the pipe, right? You would find out why the pipe was broken and why the water was spilling on the floor. I mean, that would be the approach you would take at home with something that isn't so precious as your body. You wouldn't want to, again, you wouldn't want to take out buckets and mops every time you wanted to pour a glass of water. Now, think of that in terms of your own health. Like, what your doctor offers typically when they prescribe medicine is they offer a bunch of towels and mops without a solution as to why you have your problem. I hear this all the time. The patient says, well, doctor says I have high blood pressure. I said, did you ask him why you have high blood pressure? He says, yeah, it's inflammation and it's because I'm getting older. I'm like, that's not an answer. That's not an answer because there's no solution to that. The solution to that is a bunch of towels and mops and buckets that don't resolve the problem, but then lead to more problems, because medicines don't come without a cost. Most people will gravitate to medicine because it's convenient, because they don't want to take ownership of their own symptoms and their own health deterioration, and it's easier to just pop that pill. But at the end of the day, popping that pill is only going to lead to more problems. Just like mopping up the water from a broken pipe is still going to lead to more and more problems. Your house is probably going to end up with mold and you'll be really sick. And so remember, medicine is the third leading cause of death. So at the end of the day, you want to know why, not what can you take to suppress what's going on, but you want to know why, what's happening in your body, so that you can make meaningful adjustments to your diet and lifestyle to overcome it. Would no grain, no pain be a good idea for someone who has colon cancer? Possibly. Colon cancer is one of the 11 cancers, Debbie, that we know gluten can contribute to or increase the risk of. So, definitely there's a connection, medically speaking. Now, there are other causes of colon cancer, and there's, nutrient deficiencies can contribute to cancers. Other kinds of foods can contribute to cancers. So it's a complex, multifactorial issue, but no grain, no pain would be a great place to start. David says, just took delivery on our meat cow, and I'm about to go carnivore. Do you have any advice to do this correctly, or is it really that simple? It's pretty simple. I think the biggest risk, long-term carnivore, not short-term, but long-term, is there are certain nutrients that you're not going to get as much of. And so what I would just suggest, David, is get with a good functional doc who can measure your vitamin and mineral status periodically, just to make sure you're not missing something as you go carnivore. Because just like with any other diet, some people go carnivore. Like I've seen everybody, I say everybody, I've seen many people do a lot of different things. And so some people I've seen do carnivore where they're just eating ribeyes, but they're not eating other things. And I've seen some people where they're eating liver on a regular basis, they're eating other organ meats, they're eating, rich, thick bone broths. So they're getting a diverse amount of different animal foods that have a more diverse amount of nutrients. But depending on how you go carnivore, I'd say if you're going more in that diverse line, then the likelihood of malnutrition is a lot lower. But if you're sticking to just a few different kinds of meats from that cow and not really eating the other parts, you definitely would want to get your nutrition levels checked periodically and just make sure you supplement to overcome any deficit. Supplements to target cystic acne on the back. Vitamin B5, Ultra B5. The other thing you might consider is vitamin A. Those two are largely linked. I mean, as a matter of fact, one of the prescription drugs called Accutane is a synthetic form of vitamin A. But vitamin A and vitamin B5 can be very supportive of skin health and acne. You might also consider getting tested to see if you have those deficiencies as well. That way you can know for certain. Yeah, I hear you, Cedal. Most of my frustration and disgust stems from how people respond to the system and the forces which architect it. It very much resembles a dysfunctional family relationship in the parents. It does. Tons of gaslighting, tons of belief without proof, tons of trust without, to me, trust is earned. Now, if you're a kid and it's your parents, trust is not so much earned as it's given, provided your parents are good people and are good parents. But yeah, the system is why people let's just take an example of this. Pfizer, who paid out the second largest criminal fine for lying about their drugs and actually murdering people, killing people, is the same company we entrusted to do a warp speed rollout of an untested, unproven product, and then force mandated to inject it into 100 million plus people. That's pretty dysfunctional, just on the surface of the fact that that company has a criminal record. And it's not the only one. There are multiple drug companies. As a matter of fact, most drug companies have criminal records where they've paid out hundreds of millions or billions of dollars in fines. Nobody's ever gone to jail. But we're talking about people dying as a result of their lying about their research, lying in their marketing, conflating facts and figures and data to get more people to take their medicines and hurting them as a result of that. Like, it's not an uncommon thing, and yet we just keep moving forward. I mean, honestly, if you look at, I like to look at empirical data, medicine is one of the only businesses in the world that continues to profit despite not having a positive outcome. I mean, we don't have less heart disease or diabetes or autoimmune disease because of medicine. We have just as much, and actually we have more. And now we have, we have the knowledge that medicine is the third leading cause of death, and some would argue it's much higher than the third leading cause, but I agree with you. But people just keep on trusting that system, and it's broken. And a lot of people's thought processes are broken. And I think part of the reason why, and again, this is just my own personal thought, if a person has to face the truth, then what that means is they have to own up to the things that they've done in the past that were wrong. So by facing the truth, they have to acknowledge that they've been wrong. And that can be a hard thing to do for anyone, including myself. And so that's one of the reasons why it's such a hard transition to make. When in medicine, how many doctors have you seen jump ship and come over to the dark side, the alternative side, so to speak? Not a lot. I mean, there definitely are some great warriors out there that have jumped ship because they had the courage to admit that they'd done it wrong in the past. But I would say that's a less common trait for most people as opposed to more of a common trait. How long is it good to take a multivitamin? Well, I take one every day, Christina, indefinitely. And especially if you're underweight and malnourished, as long as, with ulcerative colitis, as long as you tolerate the multivitamin, it's perfectly fine to take it every day. I would say, if you're looking for one that generally is a low allergenic and low irritant, check out Ultra Nutrients. I have a lot of people that have come to see me with ulcerative colitis that do really, really well on that vitamin, where certain other vitamins have fillers, dyes, and preservatives and chemicals that can actually exacerbate or irritate folks with ulcerative colitis. So check that out. Susan says, I'm 69, been in menopause for 20 years, but tests show estrogen levels of a 20-year-old. Any thoughts what could cause that? I mean, that might be a good thing, Susan. I would say don't worry about trying to detox from high estrogen unless it's high. If it's equal to that of a 20-year-old, you might ask, though, there are a couple of tests that you might ask your doctor to run, and one would be an estrogen metabolite test. So there are about 8 different metabolites of estrogens, and those can be measured. And if you have high estrogen, what you really want to get a breakdown of is what kind of estrogen, because there's estrone, there's estradiol, there's estriol, there's 16-hydroxyestrone. There are a number of different types of estrogen. So ask for that estrogen metabolite test and see, because certain estrogens have an association with higher risks of cancers and heart disease. And so the answer to your question is in which estrogen metabolites you have that are high or low, because if you're looking at maybe doing a nutritional estrogen detox, then there are certain nutrients that can help you do that depending on how that test comes back. But if you have a doctor that understands that, you've got a good doctor, and that's where I would suggest that you start. Thoughts on vagus nerve related to digestion? I do the right things, but still constipated. I mean, the vagus nerve is part of the parasympathetic nervous system that controls the digestive movement, right? So the peristaltic action of the digestive tract, and it is a pretty important part of that. And some people live kind of in a state of fight or flight or in a state of chronic anxiety or stress, and so that is going to be one thing that's not dietarily related that does affect them and affects their ability to have regular daily bowel movements. So, if you're trying to improve the functionality or you suspect poor function of your vagus nerve, one of the best things that you can do if you've already changed your diet and you're dialing in your diet really well is visit a chiropractor. There are a number of different adjustments that can help improve neurological flow of your vagus nerve. And there are a number of other strategies as well. But that would be one if you've done everything you know to do. What do? We go to bed on time, we get plenty of sunshine, we exercise, we get good sleep. Those are just fundamental places to start. And beyond that, there may be something deeper going on that you need to get investigated. So I'm grain, dairy, and processed sugar-free, and my abdomen cramps up for hours after breakfast. I'd say, what are you eating? Because you might be allergic to some of the other foods that are sensitive to some of the foods that you're eating, and that would be, a good place to start, Andrew, is by getting some testing done where you can understand that. Donna says, I'm from the UK, following no grain, no pain, but I seem to be getting a gluten-mimicking reaction to tomatoes, papaya seeds, mushrooms. Do you think this might be a histamine issue or gut damage? Well, it could be that you're just reacting to those foods particularly, Donna. I mean, other foods can cause reactions too, and that's unique to the individual. So, there's 3 rules when we're eating that we always want to think about and try to follow to the best of our ability. Rule number 1 is you cannot get healthy or restore your health eating food that isn't healthy, right? It's the common sense rule. Rule number 2, listen to your body. If your body is rejecting certain foods or behaving by sending you symptoms when you eat certain things, then your body's right, quit eating them. And then rule number 3 is don't eat what you're allergic, sensitive, or intolerant to. And without testing, it's hard to know. I mean, you could have a histamine issue, but those foods wouldn't be at the top of my list of suspicion for a histamine issue. You could also have gut damage, prolonged gut damage from years of gluten exposure before you changed your diet. It still needs to heal. Those are all possibilities, but I don't know if that's helpful for you or not. I have stage 3 kidney disease. What's the best diet? There's no best diet. The best diet is the right diet for you. And if you've got stage 3 disease like that, you want to get tested. Get yourself tested for food sensitivities. If you're already gluten sensitive and you're already avoiding that, fantastic. But you've got to know the best diet is unique to the individual. There is no one size fits all approach. I mean, if anything we've learned in the last 20 years in nutritional science, it's that, one size fits all is wrong. And, no grain, no pain was written as a generalization to people with autoimmune disease. But even no grain, no pain is not one size fits all, which is why in the last chapter of the book, I talk about test, don't guess, nutritional testing. So, this is where, you have to get, if you haven't read that last chapter, go back and read it because it tells you the different types of tests and the different types of things that you need to look at so that you can cater your diet to your needs and not try to follow a generic diet. I like this. So your antihistamine capsules work. Eating sauerkraut and raw honey could not do before. So those of you who want to know what that's Histassist is what they're talking about there. So Histassist has got a number of different ingredients in it. But as I was talking about vitamin C earlier with people with histamine intolerance, vitamin C is one of the things that when low can cause histamine intolerance, and other things can do it too, which is what Histassist is designed around. That product is designed to help stabilize your mast cells to not overproduce histamine. And so anyway, thanks for sharing that experience. What do I think of Golo, Exapure, and some of the weight loss supplements? I'm not a fan of weight loss supplements. You want to lose weight, there's no shortcut. It's like with many other things that are good in life. There's no shortcut to value. And I think people are so busy. We used to see this in grad school so there were students when I was in grad school, they would work so hard at trying to cheat, right? Trying to cheat at the tests, cheat in the class. They worked harder at cheating than they did at studying. And if they would just put the same amount of effort in the study, then they wouldn't have to cheat, and then they would have the knowledge forevermore, and they would be good doctors, right? And so people do that. They have that same kind of philosophy or mentality a lot with weight loss. It's like, what pill can I take that's going to accelerate my weight loss? That's cheating. No pill is going to accelerate your weight loss and keep your weight off without having a consequence. So a lot of those weight loss supplements are dangerous. They accelerate your heart rate. They're just not good for you. And they don't work long term anyway, so you're not doing yourself any favors. As a matter of fact, you're damaging yourself while spending money, and you're not getting the result that you want. And if you would just quit trying to take a shortcut and look at fundamentals, then it will come. And I'm not saying, Sheila, that you're not doing those things. I'm just giving you my opinion. So put in the work. And what is the work? There's you guys have heard me talk about the 6 non-negotiable fundamentals of life if you want to be healthy. And that's the right diet, that's exercise, sunshine, sleep, clean air, clean water, and stress management. Do those 7 things and do them well every day. Think about them. Don't obsess over them, but think about them, and think about, if you're not doing them, how you can improve your life by applying those 7 things. And if you're not, then, and you're trying to do something to accelerate your health passively, it won't happen, I promise. You might have a minor victory here and there with a passive therapy or a supplement or a pill, but at the end of the day, you're not going to get anywhere. You're going to go backward. I wake up throughout the night with cramps in my legs. Is there a nutritional basis for this? Yeah, calcium oftentimes is a trigger for that, so I would look at calcium first if you're waking up with nighttime cramps in your legs. Okay. I started Ultra Nutrients. Seems like I pee a lot of it out. Could it be because I weigh 110 pounds? No, when you take a good product, your urine is going to turn yellow. When you take a good multivitamin, if your urine's not turning more yellow, like a brighter yellow, then either 1, you're not absorbing it, or 2, it's not a good product. It doesn't have what it says it has, if we're talking about a multivitamin. So remember, B vitamins are water soluble, so you're going to see it coming out in your urine. It doesn't mean that you're peeing it all out, and it doesn't mean it's not helping you. It just simply means that your body does let some of it go, and that's okay. Okay, I think we're probably 25 minutes over. We'll get certain type of calcium is better. Check out Ultra Cal Mag, Martha. We'll put a link up for you. A 20-year-old daughter had a kidney transplant 1 year ago. I'm sorry to hear that. I hate that you guys had to go through that. Nephrologist has her take 50,000 milligrams of D, you mean 50,000 IU probably, of vitamin D once a week. Can that level deposit into the vascular system? I mean, vitamin D is not going to deposit into the vascular system. If she's taking 50,000 milligrams once a week, that's probably a pretty safe dose, especially if the nephrologist is recommending it, because one of the contradictions to taking high-dose vitamin D is kidney damage. And if he feels confident enough to make that recommendation to you with that transplant, and I wouldn't worry about it depositing into the vascular system. You'd be perfectly fine to do it. Okay. I didn't get to every question, so if you asked one and didn't get an answer, it's just because I took an extra 30 minutes and still didn't get through them all. So come back next week. We'll be back on Tuesday evening at 6 p.m. Central Standard, and we'll be back next Thursday again at 12:30 Texas time, Central Time. So don't forget to come visit me at Gluten Free Society. If you are new to all this and you're not sure where to start, we've got some great master guides to help you on your way. We've got tons of free information that you can come grab. Just come sign up for our newsletter and we'll send all that to you at no charge. And if you're looking for premium quality supplements, don't forget to support us. It's glutenfreesociety.org. And the sale this week, we've got a sale on probiotic this week. The code is PRO, P-R-O, and that saves you 20% on your choice of probiotic. We've got several different kinds. We've got Ultrabiotic Defense. We've got regular strength Biotic Defense. We've got Biotic Defense with S. boulardii, and we've got something called Biotic Force. So any of those you can save 20% on this week using the code PRO. That's P-R-O. Come visit me at glutenfreesociety.org. Have a fantastic weekend. We will see you next week.